We are about to meet with Markowitz, Dr. Michael Markowitz, and we'll have to find out his story when he gets on. How are you?
I'm doing pretty well. I'm under strange times and circumstances, and for both the medical world and the musical world.
Do tell me about it.
Well, from the medical perspective, clinic flow has gotten a little bit different. We're doing far more telehealth, and we've rearranged our clinic into a well side and a sick side. And there's one provider a day who dons all the protective gear, who sees the sick and suspicious patients, whereas the other providers see the patients who don't fall into that category, and everyone's doing a little bit of telehealth. We're actually a lot of telehealth. We're almost at 50% televisits.
Wow, that's a big change for you, isn't it? And what's that like doing telehealth?
You know, like everything else, there are advantages and disadvantages. So one of the nice things about it is if a patient is at home, we get to see a little bit of their home and a little bit of their environment, hear people in the background who we might not hear otherwise, and see their pets. So there's a little bit of hominess there. It can make the visit go more quickly because we generally don't do much of a physical exam. Our exam is limited to what we can see on the screen. So I see you've got good neck movement. You're clean. Your skin from the neck up looks healthy and clear. All your facial muscles are working.
I can smile.
Okay, you're speaking in complete sentences. You're alert and oriented. So that's my physical exam. And unless you want to show me that lesion on your elbow.
Well, that's really interesting. That's a really pretty major change for how you're providing medical care, as well as it gives me a sense that you're being able to have maybe a little bit more of a holistic approach if you're actually kind of in their home.
As much as within the limitations of the technology.
So are you primarily working from home, or you do go into the office still then, right?
Yes, I have not worked from home other than to catch up on charts. So I still go into the office every day.
So are you seeing different things coming up in your practice because of the COVID-19 issues?
I think we're seeing less frivolity. Patients who would normally come in with the proverbial hangnail or I've got a cold, don't come in. Some of them are being steered away at triage, like, oh, you have cold symptoms and a fever, but it's not too bad. Just stay at home and call us if things get worse. We'll check up on you. A lot of patients really don't want to come in. And I've had some phone calls from patients who need to come in, who refuse to go to an emergency room or refuse to come into a clinic because they're so terrified that they will catch coronavirus. And sometimes it's an effort to convince them that their risk of not being seen probably outweighs their risk of catching coronavirus or suffering from coronavirus, which is a very real risk. But a lot of medicine is risk-benefit ratio, risk management, and erring on the side of the least risk.
Well, that's very interesting. So you personally have not had a coronavirus patient at this point, or have you?
Oh yes, I have. Without violating HIPAA,
Correct.
I have had patients come in with mild symptoms who nonetheless were in a category in which we are more likely to do testing. So for instance, healthcare workers, first responders, people who live in group home settings, foster parents of many children. Among those, I had one positive, and there were also some children in that household who had symptoms but did not meet criteria for testing, but are presumed positive. I think in all, I don't know the latest number for El Rio, but we don't have a dozen positive tests yet. So it's still very low level, but we're seeing many more people who are suspicious who either have a negative test or who are untested. And considering the sensitivity of the test is somewhere perhaps 60 to 80%, even when we have a negative test, if we have a highly clinically suspicious patient, they probably have it.
So you use the term presumed positive.
Well, if there's someone who has had close contact with someone else who has tested positive and then has a similar clinical picture that is highly suspicious, but they don't meet criteria for testing, we will presume that they have coronavirus, although we cannot prove that.
Well, that's
and
really interesting.
And they should be treated as presumptive COVID and be encouraged to quarantine. And we have our sets of rules about that. And people follow those rules variably, as you've probably seen in the news.
Yeah, so you have some patients who are more able to follow it and some patients who have a more difficult time following the guidelines for lockdown / social distancing.
Yes, social isolation. Yes, and some of that's socioeconomic. Some patients need to rely on others for transportation, for shopping, or they may live in a setting where literally to go to the bathroom, you have to walk past other people in the hall. And El Rio also has a number of homeless patients, and we actually have a homeless outreach task group, which is doing wonderful things, trying to get them tested, get them sufficient resources, and to encourage proper sequestration given the parameters of their existence. As I briefly mentioned, I work for El Rio Community Health Center. We are one of, if not the largest, provider of health care to the indigent population in southern Arizona, although that is not our only population. And the organization is truly doing a wonderful job taking the outbreak by the horn, so to speak, or by the corona. One of the first clinic locations was the El Rio neighborhood by the Santa Cruz River. I don't know exactly where the first clinic location was because it's moved. The main center now is on Congress Street, so it is a little bit west of both the highway and the river, but there are many locations all around town. I've lost track of how many clinics there are. There's one on the Yaqui Reservation. We recently incorporated St. Elizabeth's Clinic into us. There's one on the southeast, there's one on the southwest, there's one on northwest, there's one on Broadway, there's one on Cherry Bell. So I'm close to running out of fingers.
I think that's really awesome that you provide services to the indigenous.
Or as we say, we serve the underserved.
Right. I really appreciate that a lot. I didn't know that was part of your clinic, that was part of its focus and its outreach. And I think that's really an important population that needs to be helped.
Absolutely.
When I spoke with Amy Munoz, she said that there were going to be some hotels or something, empty hotels that were going to start to be used for homeless people and helping them to get services.
Yes, as far as I know, because I'm not directly involved with that outreach group or project, but yes, some of the homeless will be housed in hotels and motels. I believe, and perhaps I'd better not digress, but I think that some will be designated for patients who have tested positive and others for those at low risk. However, I am neither an official spokesperson for El Rio, and I want to make that clear. I'm speaking as an individual, not for the organization, while I sing their praises. And also, I'm not sure I have that particular fact exactly correct.
All right, duly noted. Thank you for that. So, as you're working with patients and people who are dealing with illnesses of whatever flavor, and as well as having some patients who are positive for COVID-19, what are some of the things that you're noticing that you would suggest that people do to be safe?
Well, it's out there. It's in the community. The spread is from people who are most likely asymptomatic at the time they are maximally spreading it, or shortly after they come down with minor symptoms. So social distancing is still the rule of the day. Stay 6 feet away from your neighbor, give wide berth, stay out of crowded places, avoid assemblies of individuals greater than 10. Pretty much everything that you've been hearing on the news and the governor's recommendations, I think, are valid. And it makes me very nervous to see people protesting and wanting to open up society again, because the fear is a second wave of infection.
You think a second wave may indeed happen?
Tough to say. It depends on what assumptions you make in your model, whether one can predict a second wave or not. So if the model says, or if the model reflects reality, and that is if truly 60, 70, 80, 90% of the population has already been exposed and has developed some sort of immunity, and if immunity is long lasting, then perhaps there won't be a second wave. But if those assumptions are incorrect, and we've only penetrated, 20, 30, 40% of the population, and there's a large segment who has yet to be exposed, and if perhaps immunity is not long-lasting, then both of those conditions are a setup for multiple waves, which will similarly overwhelm the healthcare system if there is a sufficient population and lack of healthcare resources relative to that population.
It does sound like it's kind of based on what is going to be the truth, and none of us really know at this point.
Correct. At this point, we're dealing with speculation, probabilities, and a whole lot of unknown variables.
How this is affecting you as on a personal level, as a primary care, as an essential caregiver, as a doctor, as being in the field, being directly involved in care?
Well, it's affected my social life.
Yeah.
I go to work, I come home, and I pretty much stay home. I do have a hiking buddy, so we go hiking on a regular basis, but we also social distance. If I do venture into a restaurant or a grocery store, it's only very briefly, and I put my mask on. But I suppose that's not specifically as a physician. That should be most everyone these days.
Right.
But I feel a little bit higher risk of giving it to someone else just because of my exposure or potential exposure at work. As far as anything else, the workflow is a little bit different. The focus is a little bit different. I hardly recognize anyone at work because we're all wearing masks.
Right. Well, I'm curious, so on a personal level, do you find it more stressful?
Overall, I would say no. I don't think my day-to-day tasks and responsibilities are any more stressful than they were prior to this. The focus is a little bit different, but other than that, I don't feel stressed. Then again, I'm working in a primary care clinic. I'm not working in a large urban center in an emergency room or an intensive care unit, where I imagine the stressors would be manyfold greater than what those of us in primary care are experiencing.
That's an interesting distinction. Thank you for that. I imagine too, we're seeing on the news how much they're dealing with direct contact with people who are directly infected, and how that is stressful in and of itself, as well as, wondering if you have enough materials.
Yeah. I'm so thankful that I am not working in that sort of a situation, because I don't know if I would be up to handling it as well as many of the heroes who are in that situation are doing it.
Very nicely put. Yeah, they are heroes, putting themselves out on the line. And you said you've also dealt with healthcare workers who are showing positive test results.
Well, some of us at work have been exposed. There are a few healthcare providers at El Rio who tested positive, but as far as I know, none of them had severe symptoms.
Oh, that's
So
good.
I don't know any more details, and even if I did, I probably I don't think it would be appropriate to share them.
Right.
Yeah,
Thank you for
but
that.
but healthcare workers are like everyone else. Some of us have chronic health conditions. Some of us are immune suppressed. Some of us are older than age 60. Some of us are on medications or have other conditions that put us at higher risk. So healthcare workers are not any more or less immune from developing complications of the illness.
We're all human beings. We're all equally able to get infected, which is why it's such a brave thing to be in the field that you're in.
Well, that's what we signed up for.
I know that's what I was thinking about that actually a few moments ago about, I asked if it was any more stressful than normal, perhaps I was asking. And then I started thinking, well, yeah, you're already seeing people with infectious diseases. You're already dealing with illness and things that, I'm not exposing myself to on a regular basis, although maybe I am, and I just don't know it, because when you're out there in the world, you don't know what people have and if they're sick or...
Wasn't there this famous medical case of a person who caught pneumonia and died from their flute?
What? From their flute?
It was either a flute or a clarinet. It was something was growing in the spittle.
I think no. Wait a minute. I think that was a saxophone. Just kidding. So what about the musical side of things for your life? Because I know that you play mandolin and you're in high demand as a mandolin player around town.
Yeah, well, I sit on my couch and noodle around a lot with various instruments and try to maintain an element of creativity. I haven't been playing out with technologies like Zoom with that slight delay. It's a little bit difficult to jam with your buddies.
Have you tried?
I have not tried, but based on verbal conversations, and actually the other day, some family members sang "Happy Birthday" to someone. So yes, we performed together. "Happy Birthday." You were either a little bit behind the beat or a little bit ahead of the beat.
Oh, that's crazy. Yeah, and if it's with Zoom, from what I understand with Zoom, whoever is speaking louder or closer or whatever, they get the little yellow outline. It blocks out the other person.
Yes. So I'm curious, what's going on in your musical world?
I am actually really lucky because my mom is here. I'm quarantined with my mom. And so she and I are practicing almost every day. We did 2 Facebook Lives early on in the thing.
I saw a performance. It was delightful.
Oh, thank you. That was really a joy. And my mother particularly got such a kick out of it. It was such an encouragement to her.
That's wonderful. Music is such a great motivator and a lifter of spirit.
Do you find that you're more busy because of what's going on?
I'm seeing actually fewer patients in a day. So if anything, I'm a little bit less busy than I was before the coronavirus outbreak. However, things are picking up. So I think that is just a transient dip, and pretty soon we'll be back to our regular capacity.
Well, Mike, it has been truly a pleasure speaking with you. Thank you so much for joining me today and hear your perspective on what's happening in the medical world here in Tucson and precautions that people can take to the best of our knowledge, and how everybody is stepping up to help with the illness, with figuring out what's going on, with trying to figure out the best way to address the COVID-19 pandemic.
Well, my pleasure. Thank you for giving me the opportunity to express some of my thoughts. I just want to remind everyone that the current pandemic is a moving target. So everything that we say today is subject to revision as we gain more knowledge.
And eventually it will be over.
Well, we have a saying in medicine that all bleeding eventually stops.
Thank you. Okay, well, thank you for that.